In 2022, a patient walked into a hospital with symptoms that seemed ordinary: fatigue, weight loss, persistent cough. The doctors followed protocol, running tests and reviewing scans. But this time, the final decision wasn't made by a human. It was made by an artificial intelligence system, one trained on thousands of medical cases. The AI diagnosed the patient with a mild infection, recommending rest and antibiotics. Months later, the truth emerged. The patient had an aggressive form of lung cancer. By the time it was caught, it was too late. Artificial intelligence in medicine is revolutionizing how we diagnose, treat, and even prevent diseases. Algorithms process vast amounts of data in seconds, spotting patterns invisible to the human eye. They promise faster, more accurate results, free from human fatigue or bias. Already, AI is detecting cancers earlier than doctors, predicting heart attacks before symptoms arise, and personalizing treatments based on genetic profiles. With every success, the question grows louder. Are we witnessing the birth of a medical utopia? But beneath the excitement, something else lingers: uncertainty. AI is not infallible. It doesn't think. It calculates. It doesn't reason. It predicts. The same systems that can catch diseases in their earliest stages can also overlook them entirely, depending on the data they're trained on. And when that happens, who is responsible? This isn't just a hypothetical scenario. In multiple cases, AI-powered diagnostic tools have misidentified illnesses, sometimes with life-threatening consequences. In some hospitals, robotic surgeons are assisting in complex procedures, performing with precision beyond human capability. But can a machine truly account for the unpredictable nature of the human body? What happens when AI must make a split-second decision in an emergency? AI is no longer a futuristic concept. It is already inside our hospitals. It is already inside our hospitals, shaping life and death decisions. It has the power to save lives, but also the potential to fail in ways we may not yet fully understand. So, if AI is already transforming medicine, what exactly is it doing right? A woman walks into a clinic, worried about a strange lump on her neck. The doctor orders a scan, but before a human can even glance at the results, an artificial intelligence system has already made its assessment. Within seconds, the AI highlights a cluster of abnormal cells, flagging them as likely cancerous. A biopsy confirms it. The AI was right. Without it, the tumor might have gone unnoticed for months. This is not science fiction. Right now, AI-driven diagnostic tools are detecting diseases at an unprecedented speed and accuracy. In some cases, these algorithms outperform experienced specialists. A deep learning system developed at Stanford identified skin cancer with the same accuracy as dermatologists. In the UK, an AI system analyzing mammograms caught early-stage breast cancers that radiologists had missed. And in China, AI-assisted imaging scans detected COVID-19 cases faster than human doctors, helping control outbreaks before they spiraled. Beyond diagnosis, AI is changing the way we treat diseases. In operating rooms, robotic surgeons perform delicate procedures with precision beyond human capability. These machines don't have shaky hands or fatigue. They can make microscopic incisions, minimizing damage to surrounding tissue. Patients recover faster, with fewer complications. Meanwhile, AI-driven drug discovery is accelerating breakthroughs. What once took years, trial and error, human testing, regulatory delays, can now happen in months. Algorithms analyze molecular structures, predicting which compounds could fight diseases before they're even tested in a lab. In 2020, an AI system designed a potential antibiotic capable of killing drug-resistant bacteria, a breakthrough scientists had struggled to achieve for decades. AI is even predicting the future of individual patients. Predictive medicine is emerging as one of the most powerful applications of artificial intelligence. By analyzing medical histories, genetics, and lifestyle factors, AI models can estimate a person's risk of developing conditions like heart disease, Alzheimer's, or even cancer, sometimes before symptoms appear. The potential is staggering. Early intervention could save millions of lives. But if AI can already diagnose, treat, and even predict diseases with increasing accuracy, a question emerges. A man arrives at the emergency room, barely conscious. His vitals are unstable, his symptoms unclear. Doctors scramble to identify the cause, but the AI-powered diagnostic system has already reached a conclusion: sepsis, a life-threatening condition requiring immediate intervention. The recommendation: an aggressive course of antibiotics. But something feels off. The attending physician hesitates. reviewing the patient's records manually. A detail the AI overlooked emerges: an allergy to the prescribed medication. Had the system's decision gone unchecked, the treatment itself could have been fatal. For all its advancements, AI in medicine is still just a tool, one that relies entirely on the data it is trained on. And that data is not always perfect. AI models learn from medical records, clinical trials, and real-world patient data. But what happens when that data contains biases? Studies have shown that some AI-driven diagnostic systems perform less accurately on patients of certain ethnic backgrounds or socioeconomic groups, simply because the datasets used to train them lack diversity. If AI is making critical medical decisions, how do we ensure it serves everyone equally? The issue goes deeper. Unlike a human doctor, AI doesn't explain its reasoning. It makes predictions based on patterns that even its own developers may not fully understand. This black box problem raises a chilling question. If an AI's decision leads to harm, who is responsible? The doctor who followed its advice? The hospital that deployed the system? The programmers who wrote the algorithm? Legal and ethical frameworks are struggling to keep up, and as AI's role in medicine grows, so do the stakes. Despite these concerns, the pressure to adopt AI is immense. Hospitals see efficiency, pharmaceutical companies see profit, governments see cost reduction, and for many patients, AI represents hope, a faster diagnosis, a better treatment, a second chance at life. But when we place our trust in machines, how do we ensure they truly have our best interests at heart? In a quiet laboratory, deep within a pharmaceutical research center, an AI system sifts through billions of molecular combinations, searching for the next medical breakthrough. Within hours, it identifies a compound with the potential to treat a rare neurological disease, something no human researcher had considered. The discovery is hailed as revolutionary. But before clinical trials can begin, another AI system, one designed to predict side effects, issues a stark warning. The same compound could also cause severe, unforeseen complications. One AI creates, another AI cautions, and suddenly, the limits of our understanding come into focus. Medicine is an art as much as it is a science. A doctor can look a patient in the eye, sense hesitation in their voice, adjust treatment based on intuition and experience. AI, for all its capabilities, operates on cold logic, statistical probabilities. It doesn't feel, it doesn't empathize, but does it need to? In some cases, patients already prefer AI doctors, at least for certain interactions. Studies have shown that people are more honest with AI chatbots than with human doctors, especially when discussing sensitive health issues. Without fear of judgment, they disclose symptoms they might otherwise hide. Could AI one day become the preferred caregiver? Not just the most efficient one. Yet, there is another side to this transformation. The more AI takes over, the less human involvement is needed. Automated systems can analyze medical scans, prescribe medications, even conduct robotic surgeries with minimal oversight. But if AI replaces human expertise, what happens when something goes wrong? The reliance on AI introduces another dilemma: control. Healthcare systems, insurance providers, and pharmaceutical giants see AI as a way to reduce costs and increase efficiency. But in a world where algorithms dictate medical decisions, who ensures those decisions serve the patient first? If a life-saving treatment is deemed inefficient by an AI-driven system, could it be denied altogether? And if we begin trusting AI with life and death choices, how do we ensure that trust is not misplaced? In the end, the question is not whether AI will transform medicine. It already has. The question is what kind of transformation we are willing to accept. A world where disease is predicted before symptoms even appear? Where no diagnosis is clouded by human error or bias? Where life expectancy surges as AI-driven treatments evolve beyond anything we could have imagined? The promise is undeniable, but so is the risk. For every breakthrough AI offers, there is a trade-off, a compromise, between efficiency and human oversight, between precision and ethical complexity. The machines we build are only as fair, as compassionate, as careful, as the data we feed them. And history has shown that data, like the humans who generate it, is far from perfect. Bias can creep in, not by intention, but by the blind spots in our own knowledge. If an AI system learns from a flawed healthcare system, will it not replicate those same flaws, only faster, on a much greater scale? Even if we could ensure perfect fairness, there remains one final dilemma. What happens when human doctors are no longer the final decision makers? When AI's recommendations become so advanced, so precise that questioning them seems irrational? Will medicine become a profession where human expertise is merely a backup plan, a A safeguard against machine failure? Or worse, will it become obsolete? Perhaps the greatest risk is not that AI will fail us, but that it will succeed beyond our control, that we will surrender trust so completely. We forget that medicine was never just about calculations and probabilities. It was always about people, about listening, about understanding more than just symptoms. And if we lose sight of that, if we allow AI to redefine the very essence of care, will we be left with a system that saves lives, but forgets what it means to heal? So, as we stand at the threshold of a new era in medicine, the question is not just about what AI can do. It is about what we are willing to let it become. This video has come to an end, but the discovery continues. Check out more content on the channel and subscribe so you don't miss what's next. Thank you for watching.